This is the equipment that you will need for the finger stick. Gloves, gauze sponges, sharp container, neonatal screen, microtainer collection tubes, requisitions form, alcohol wipes, lancet, glucometer, and capillary tubes. First, I'm gonna show you the HCT, which is the capillary test. You will need the provider's order and lab requisition and the patient's health record. First, you will have sanitize your hands and put on disposable gloves and assemble the materials needed. If the capillary tubes are self-sealing, fill two tubes by inserting the end opposite and sealed end into the well-mixed EDTA blood sample. You will have to wipe the outside of the tubes with clean gauze without touching the wet open end of the tube. Place the tubes opposite each other in the centrifuge with the sealed ends securely against the gasket. Note the numbers on the centrifuge slats and record the numbers on the log sheet along with the patient's name. Secure the locking tab, fasten the lid down, and lock it. Set the timer and adjust the speed as needed. Allow the centrifuge to come to a complete stop. Unlock the outer locking tab and then remove the inner lid. Remove the tubes immediately and read the results. Dispose of the capillary tubes in the sharp containers. Disinfect the work area and properly dispose of all biohazard materials. Record the results in the Hippocratic patient log and document the lab's results in the patient's medical record below. Now I'm gonna be showing you the hemoglobin HbG test. For this test, you will need the patient's health record, provider's order, and/or lab requisition. Perform an instrument quality control check by inserting the control cuvette into the instrument. Make sure the reading is within acceptable limits before proceeding. Sanitize your hand, put on disposable gloves. Assemble all the equipment and supply needed. Greet the patient and verify his or her identity using two identifiers. Have the patient spell the last name, state the birth date, and/or show a picture ID. Examine the patient's fingers and choose the site to be used to obtain the blood sample. Clean the site with alcohol or another recommended antiseptic preparation. Perform a capillary puncture and wipe away the first drop of blood. Obtain a large drop of blood on the surface of the finger. Touch the microcuvette to the drop of blood. Do not touch the finger. The correct volume is drawn into the cuvette by capillary action. Wipe off any excessive blood from the sides of the cuvette. Place the cuvette in the cuvette holder and insert it into the instrument. Read the results and record it in the lab's hemoglobin log and the patient's health record. Turn off the instrument, dispose of biohazard waste in the correct containers, and properly disinfect the work area. Remove gloves and dispose in biohazard waste. Now I'm gonna show you the glucose test. For this test, you will need patient's health record or flow chart. First, you will have to sanitize your hands, put on disposable gloves, assemble the materials needed. If you are using a test strip from a new unopened container, you must change the test strip code chip. Place the meter on a flat surface so that it will not vibrate or move during testing. Greet the patient and verify his or her identity using two identifiers. Have the patient spell the last name, state of birth, or show a picture ID. Examine the patient's fingers and choose the site to be used to obtain the blood sample. Prepare the site by doing the following before lancing the finger. When you are ready to test, remove a test strip from the patient container and immediately close the container. Insert the test strip as far as you can into the meter. This powers the meter on. Disinfect the finger with alcohol and wipe dry. Perform the finger stick. Hold the incised fingers very close to the target. Apply 1 drop of blood onto the top or side of the target area and wait until you hear the beep. The result appears in approximately 1 minute. It may be displayed in 3 ways: as the international normalized ratio, as the pro time in seconds, or as quick. Record the results in the lab's patient INR log and in the patient's warfarin therapy flow sheet and or electronic record. Circle any results that do not fall into the desirable ranges column of the preceding table based on a patient who is on low anticoagulant therapy. Dispose all the sharps in the biohazard sharps container and regulated medical waste into the biohazard waste container. Disinfect the test area and remove your PPE. Sanitize your hands. Now I'm going to give you an explanation of the difference between HBG, glucose, and HCT. Hemoglobin is the iron-based molecular type that gives blood its red color and ferries oxygen to the rest of the body. Hemoglobin is also a protein in red blood cells. Hematocrit is a measurement of the amount of red blood cells as related to total blood cell count. Blood sugar or glucose is generally measured in 2 ways. The first way is usually done in a lab and tells you, doctor, about your HbA1c, or often just referred to as A1c. This measurement is a percentage of hemoglobin that is bound with glucose in your blood. Hemoglobin, abbreviated as HbG, is the part of the red blood cell that carries oxygen to your cells. Glucose, which is also used by cells for energy, hitches a ride on the hemoglobin and with the help of insulin gets into your cells, where it is used for energy or store energy. This is the difference between the 3 tests.